All right, so I want to talk about my labor and delivery. So, Noah was born August 23rd, 2013, and it was a really, matter of fact, with the hyperemesis, I went through a lot with him. So I was in the hospital. They knew me by name. They knew me by face. I walked in and they had everything ready. It was that serious with me. From week 6 of the pregnancy all the way to week 38. And it was just very rough. And so when I went into delivery, well, matter of fact, they induced me, and they had to induce me because I was having cramping. I thought I was going to labor and delivery, but they actually saw I was not dilated at all. Matter of fact, I was in a pregnancy. As you go along, you dilate, from 1 centimeter to 2 centimeters. It kind of stays there until like the last week, and that's when they go from like 2 to 10. Well, I went from like 0 to 1 to 2 back to 0. Yeah. And that was at 38 weeks, which doctor said it was fine. There's nothing wrong with it, And at that time also I had they call it like a cycling cervix, which meant that my cervix was, it's not a funneling cervix. That's what it's called. I apologize. And that basically meant that the baby's coming out. And so when my cervix closed back, it was alarming, and it was just a lot of stuff. But at this particular day, I went with my best friend, and because my husband was working night shift, and we went in, and the doctors were like, "You're not contracting enough. You're just having regular Braxton Hicks contractions, but we're not going to release you because your blood pressure is rather high." And I believe it was like 200 something over 100 something. It was high. And it got to the point where my blood pressure was gotten so high, they're like, "We have to induce you because you're going to burn that baby up inside of you." Which at that point, I was alarmed. You don't want to hear anything. I'm already going through all this hyperemesis problems, and then all of a sudden they're like, "You're going to burn this baby up." So they told me that for procedures, in order to bring down my blood pressure, they're actually going to give me an epidural. Now, let me tell you something. Remember I told you before that I do not do well with hormones, with medicine. Like, my body I have to be all natural. So, y'all understand why I said that. But, with Chloe, as soon as they gave me the epidural, probably like 10 to 15 minutes later, not even that long, but I was delivering, and I felt it all. And so when they gave me the epidural with my son, they told me, they're like, "Okay, we're going to give you the epidural, we're going to administrate it to you so that it brings down your blood pressure, and hopefully at that point, we can have a regular delivery." Well, they administered it. I love my anesthesiologist. She was the greatest. She was so funny. I wish I could remember her name. I think it was Carolina. I don't know. But she was such a great person. She's funny as heck. So, she gives it to me, and she's like, "So how long?" I told her my story that I just told you guys. And I was like, "Well," she's like, "I probably would give you probably 30 minutes from here. You'll probably deliver the baby." She left the room, and I felt like a boom, boom. And immediately I knew that it was the baby coming down. I told the nurse, "I think that the baby's coming." She's just like, "No, the baby is not coming." I love you, honey.
I love you, babe.
I love you too. She's like, "No, the baby's not coming. Babe, we just gave the epidural, and we were just not even dilated. You're good." She checked me anyways, and she's like, "Oh my gosh, she's 10 centimeters, let's go. I was like rushing all over the place. I was like, why does anyone listen to me? I know my body. So anyways, they took me off the epidural, and I felt everything. They gave me an oxygen mask. They gave me, it was like boom, 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 time to go. And the funny thing is, Noah actually came out not head first, but hand first. So the doctor was there my doctor wasn't even there to be able to deliver the baby. It had to be some stand-in doctor at the time because my doctor was on her way. So the doctor is sitting there. He's like, oh, I was in Miami and I had a Hispanic doctor, and I had no problem imitating my Hispanics. You know, I had love for you guys, everybody. I had love for everybody. But he was like, oh my gosh, come look, this girl is the baby Hannah. I've never seen anything like this. Come look. And I was like, dude, delivered my baby for me, please. And and then you know, they're delivering, and you know, they pull him out, and that's good. And then the doctor, you know, they do what they have to do. The placenta comes out. They give me some you know, those little blue sheets that's really absorbent. They put it underneath me because they have some more stuff to do. And then I'm sitting there and I'm just feeling like gushing. And I tell the nurse, because this time the doctor's gone, I'm taking the baby, and I'm like, I'm feeling gushing. I don't know what that is. I'm feeling gushing. And they're like, I don't know. So the nurse comes. She's like, wow, it's a lot of blood. She changes it. She puts another thing underneath there. And not even a minute later, I'm like, I'm feeling a lot of gushing. And then she comes back and she's like, wow, you're bleeding a lot. So she changes it again. She puts another one on. And then she's like, well, not she, but I'm like, I'm just, my body, and as a matter of fact, I'm feeling like drained at this point, you know? And I'm just like, I don't know what's going on, but I'm feeling a lot of gushing going on. And she goes back and she looks and she's like, okay, I'm calling the doctor because you are bleeding a lot. So she changes it again, and she puts another one there. And of course, this one I fill up also in no time. I'm talking about, these sheets are probably like that long, this big, and the entire thing is soaked. And you know, I'm alarmed. My husband stepped out because he was so happy, and everything just changed in a blink of an eye. Like, seriously, the doctor had to come back in, and she's sitting there, she's taking out extra stuff. I do not know what's going on. At this point, I'm freaking out. I'm in pain because I felt everything. I had a natural birth, and I'm in pain. I'm freaking out, and she's like calling for people. You know, you've ever seen like ER? That's what it was like. Imagine on the bed, and you just had a baby. I want my baby here. I want to be able to hold my baby. I can't hold my baby. I'm going through another procedure right now, and I'm freaking out. My best friend is freaking out. She's trying to give me words of encouragement. Relax, you got it, Chanel. Calm down. The doctor's got you. And I'm like, no. And the doctors are like going crazy. She's like, stat this, stat that, this. So as soon as she was able to, matter of fact, they stuck me like 4 times with the I'm pretty sure my nurses out there are gonna understand this is, but it's a type of injection that makes you stop bleeding if you're bleeding a lot. They had to stick me 4 times, and that was how serious. And when they told me, like, say you have, I'm not sure on the numbers right now, so please don't kill me if I'm wrong, but you have, like, say you have 7 units of blood that you need to have, or I'm saying it wrong, I know I am, but let's just use in our head 7 units. Like, your body from head to toe has like 7 units that you need. I had to have 5 blood transfusions at the end of that, and I was on magnesium, I was on potassium, I was on calcium. They had to be, like, I stayed, usually in a hospital you're there for a day and a half, 2 days. I was there for a week and a half, like, seriously. And it was very rough. But I'm here to let you know that whatever you go through, if you believe in God, He's here and He's going to protect you. He's going to take you through it, because I know He took me through it. And I have most beautiful children, and that was why we were a little apprehensive. Like, after the second child, we were like, oh, we have a boy and girl, we're done. As much as we would love to have more children, I just don't think that my body, it was not a pleasant experience. And so we were like, we're done, we're gonna get the IUD. We put IUD only because in case years down the line we want to change that plan and have some more children, that option was still there. But with this next baby coming along, I'm pretty sure this is going to be the last that we're having, which is fine. I think 3 is a very lucky number. Excuse me, oh my gosh. 3 is a very lucky number, and that's just it. Like, I don't know. And like I said, if God wants us to have more children, He's going to see it that way. So I'm happy. I'm so happy. And I know He's not going to give me more than I can handle, like I said. And I'm just ecstatic. I am. I can't wait to see this new baby's face and kiss the babies up. I love children. I love my family. And I love you guys. And I pray for you every night. So I guess if you have had experiences like that, I definitely want to hear about it. So please comment below, let me know, and let's share our stories. Bye.